Today I will show you how to enter in a patient route slip into the computer. Step 1, you put the patient's name, the student provider's name, the provider number, and the date. For step 2, you will do this on the initial appointment. You will check the initial appointment, how you recruited the student, the age of the patient, and whether the patient was medically complex, special needs, cultural diversity, or a boards patient. For step 3, this is when you provide your assessments. You will check this box every time assessments are taken, and this may be for multiple appointments. You will also check if any x-rays were taken and what kind were taken. For step 4, you enter the NSPT provided, the calculus case type, and the quadrants completed. If partial quadrants were scaled and not completed during that same appointment, you will check the continued procedures box. Step 5 is for patient completion and any adjunct therapies provided. During patient completion, you will check the patient completion box, the completion letter, whether the patient has a dentist or not, and any adjunct therapies that were provided. Step 6, you will enter the number of appointments left for the patient and the number of appointments in the computer if there are any left. So now I will show you a mock patient route slip. So we have Joe Blue is the patient. The provider is Sarah. Her number is 12 and the date. On this appointment, it was the initial appointment, was a student recruit. The patient was an adult and medically complex or special needs. All the assessments were done and an FMX x-ray was taken. The patient NSPT calculus case type was a 2 and all 4 quads were scaled, so all 4 boxes are checked. This patient was completed, so the patient completion is checked, patient completion letter, and this patient has a dentist. During this appointment, fluoride was applied to the teeth as an adjunct therapy. There are now no more appointments left for this patient, and there are no appointments entered in the computer. I will now show you how to walk out the route slip on the computer using the same information for Joe Blue. So you will highlight the appointment and click on the walkout, which is a little blue man with a green arrow. And then you enter in the number that correlates with what box you checked. So for initial appointment, I'll check that one. My patient was a student recruit, and the number for that is 00007. My patient was an adult. An adult. There it is. And they were medically complex. I performed all the assessments on this day. I took an FMX x-rays. My patient calculus case type was a 2. And then I'll select the surfaces that NSPT was provided, and all 4 were provided, so I will put in NSPT2 4 times, being sure to include each quadrant that was scaled and making sure not to repeat any of the same. This is a very important step. The patient was completed in this appointment. So I'll put patient complete. The patient completion was given to the patient. Patient completion letter. And we provided fluoride during the treatment. Now it is smart to double check that you have all of your checks and making sure that the NSPT and quadrants provided are the correct ones and that you have provided treatment to all 4 quads. Once you're done, you will hit save. Yes, you're ready to walk out the statement. And once that is done, then you're done.